Grief is a normal response to loss. One of the major types of loss is the death of a loved one. Loss can also include a breakup, divorce, or other life transition. Significant changes in daily routine or disruptions to a sense of normalcy or safety after a large-scale emergency event, like the COVID-19 pandemic, can also result in a sense of loss. Grief influences many areas of our lives, causing physical, emotional, behavioral, and spiritual reactions. Physical reactions could include a lack of energy or fatigue. People may experience a wide range of emotions when they're grieving, like sadness, anger, or guilt. People who are grieving may cry, have changes in sleep or appetite, or withdraw socially. Or they may question their religious or spiritual beliefs or the meaning of life. As of February 2021, over 500,000 people have died of COVID-19 in the United States. In Ohio alone, over 17,000 people have lost their lives. Due to this loss of life and other types of losses associated with the pandemic, many people are currently experiencing grief. There's never a good time to experience a loss. Grieving the loss of a loved one during the pandemic may be especially challenging, as many people are experiencing increased stress and anxiety. For example, changes in employment status, work environment, school, or social life might complicate the grief process. In addition, being unable to visit a dying loved one in the hospital or not being able to gather in person with family or friends for a funeral could make it difficult to have a sense of closure. The pandemic might also make it more difficult to obtain the support needed during the grief process or engage in certain stress-relieving activities. Here are some tips on coping with grief if you've lost someone during the pandemic. First, set aside time to listen to your own needs. Know that it's okay not to be okay, and give yourself permission to attend to your own needs. You can commemorate your loved one by sharing stories about them or memories with your family or friends. Engage in activities that are significant to you and the loved one that you've lost. Seek support from friends, trusted community leaders, or mental health professionals. And utilize resources, support groups, or hotlines that are available to you over the phone or online. You can help others who are grieving by simply listening and inviting them to share. Empathy can be a powerful antidote for social isolation during the pandemic. Check in regularly to see how the grieving person is doing, and help them identify resources available to them, whether online or through their network of family and friends. You can also mobilize others that can help support the person who is grieving. During the COVID-19 pandemic, people may have experienced many different types of symbolic losses and changes in their lives. We might be tempted to think that our losses aren't as bad as what others may have experienced, but it's important to remember that all losses are significant. Find healthy ways to express your grief or feelings of loss, like talking to friends and family, creative outlets, exercise, or therapy. Try not to rely on alcohol or drugs, stress eating, or excessive use of the internet or social media to numb your feelings. Try to create new routines that can give you some sense of consistency in your daily schedule. And most importantly, be kind to yourself and set realistic expectations. Psychologists can provide a variety of services that may help cope with grief or other difficult feelings. You can visit the Ohio Psychological Association website to find a psychologist. You can also visit goodgrief.org or the CDC coronavirus website to find more resources on dealing with grief. If you or someone you know needs immediate support, you can connect with a trained crisis counselor through the Disaster Distress Helpline by calling or texting 1-800-985-5990.